Bryan Health takes the responsibility to lead and to do the things that make everyone better, healthier, and moving forward together. Here's another of our Bryan Health Radio podcast interviews with Melanie Cole.
Bryan Health hosts a community run every October to further their commitment to wellness and mental health. For more information about this event, go to bryanhealth.org/run. This special podcast series is brought to you by Bryan Health and the Kim Foundation. Everyone can feel low, anxious, or unable to cope from time to time. These are all normal responses to life's challenges. However, exercise can have a profound impact on your mental health. My guest today is Dr. Dave Miers. He's the Counseling and Program Development Manager for Mental Health Services at Bryan Medical Center. Welcome to the show, Dr. Miers. So tell us about the link between exercise and mental health. What are some of the benefits for mental health with exercise?
Well, we do know that regular exercise is good for the body in general, but we also know that is one of the most effective ways to improve your mental health. Individuals generally feel better about themselves after they do a workout of some kind. So exercise is said to really improve your overall mood. Some of the other benefits are your kind of sharper memory and thinking. Individuals report higher self-esteem, better sleep, more energy, evidence of a stronger resilience or your immune system. Then there are also some other theories out there that talk about how exercise impacts your brain by increasing serotonin, which is a neurotransmitter that is targeted by some antidepressants that individuals are prescribed for depression. Other research points to how exercise helps with anxiety, that individuals who exercise and have anxiety tend to respond better to stressful situations if they're involved in some type of an exercise program. And it also is proven to help reduce stress and reduce tension. So there's a lot of benefits to exercise.
So, Dr. Miers, when we're talking about the happy hormones, serotonin and endorphins, people hear about these. What type of exercise helps to stimulate these? Are you talking about cardiovascular exercise, weight training, combination, yoga? What are you talking about?
Well, when you think about exercise, it can be any type of exercise, but generally we talk about individuals doing some type of, what I say, moderate exercise. Generally where you're breathing just a little bit heavier than normal. So it's important that you don't overdo it, but that you can even just start small. It's better starting small than not starting at all. So even if you pick, let's say 5 minutes a day, start with 5 minutes a day to where you are walking, running, or using a treadmill. So let's say that you say, well, I'm going to walk around the block today. Take 5 minutes to walk around the block. that is a goal that you're setting for yourself. Taking kind of a brisk walk to where you're breathing a little bit heavier than normal, walk around the block, and then the next day maybe pick, today I'm going to do 2 blocks, and then kind of build yourself up from there. But starting small and working up to a little bit more is a good place to start.
So give us some other starting tips for people who maybe haven't been someone who's exercised, and you recommended starting small with walking. What about some of the other types of exercise? How would someone go about getting involved in those, weight training or classes?
Well, you could reach out to a local gym or look at to the local hospital. We have programs through our Life Point program at Bryan Medical Center. But if you don't want to reach out to a program, even just looking at such as like mowing the lawn or going for a bike ride, walking the dog, stretching while you're watching TV, getting involved in like a softball league or a volleyball league with friends. If you're working, thinking about work, if you need to take the elevator to the floor you work on, maybe start taking the stairs. Or when you go to work, think about parking farther away and then walking, into the office. And those are just all some different ideas that individuals can, think about that, doing something different than you normally do that increases your exercise.
So what else is important for good mental health? You mentioned sleep before. What about things like meditation, mindfulness, good quality sleep? How do those help with mental health?
Well, when we talk about we're talking about exercise. Exercise is very important, but to go along with the exercise, sleep is very important. So if you get making sure you're getting the adequate amount of sleep, getting to bed on time, getting into a sleep routine, and then good nutrition, making sure you're eating a balanced diet. When I mentioned reaching out to LifePoint or an exercise facility, a lot of times there's programs there to help you look at the nutrition as well, and looking at your nutritional aspect of your life. Having a balance with your sleep, exercise, and nutrition leads to improved health, but also improved mental health.
So do you feel that meditation, relaxation is important for mental health?
Yeah, a lot of times individuals try relaxation techniques, meditation, yoga, some different things to help relax themselves, and that has been shown to help individuals in terms of getting the sleep, and as part of kind of your exercise routine as well. So it's important to try different things and try the things that work for you, and to find a balance of what is working and what you like to do.
Dr. Miers, when should someone seek help for their mental health?
Well, it's important to know that mental illnesses can impact anyone, regardless of age, background. And so if a person is not sleeping well, let's say you're sleeping too much or too little, you have low energy, and let's say you have loss of interest in activity. So you like to play basketball, or you like to sing in the choir, and all of a sudden you just kind of find yourself really pushing yourself to do those things to where maybe you just don't want to do those things at all anymore. Feelings of hopelessness, maybe trouble concentrating at work or at school, and then change in appetite. You're eating too much or too little. If those are some of the symptoms, if that goes on for a period of 2 weeks or more, and it's impacting your life at home or at work, then it's important you do seek help from a physician, a mental health therapist, someone that is qualified to talk to you about your symptoms and to make a recommendation diagnosis as far as what can help. Exercise, sleep, and nutrition are things that can help with that. But if you're having these symptoms for a period of 2 weeks or more, it is important to get professional help.
What's available at Bryan Medical Center?
At Bryan Medical Center, we have the Bryan Medical Center West here in our emergency room. We have one of the few dedicated mental health emergency rooms of its kind in the United States. So we have mental health staff available, nurses, social workers in our emergency room. And the emergency room here for mental health is available 24 hours a day, 7 days a week. So if somebody's in a mental health crisis, they would come to the emergency room, and they do an assessment to determine if hospitalization is needed. If it's a non-crisis, you could call the Bryan Counseling Center at 402-481-5991, and the Counseling Center has therapists, psychologists on staff that can work with individuals on an outpatient basis, on a non-crisis basis for outpatient counseling. We also have free screenings available on our website, bryanhealth.org, and you can have depression screenings, anxiety, post-traumatic stress, alcohol screenings. A great resource. It's free, confidential. It's not a diagnosis, but it tells you whether or not the signs and symptoms are there, and then what steps to take to get help.
In just the last few minutes, give your best advice for the people listening about mental health and exercise and the things that they can do to help themselves, along with seeing a counselor or a professional should they need it. But what else can they do? Give us your best advice.
Well, it is important that you reach out for help. I mean, if you have concerns about your mental health and you're experiencing some symptoms, it is important to reach out for help and to see what might be going on in your life. It is a sign of strength. It is important there's a lot of resources there. We have resources here at the medical center, and that's an important thing to do. Exercise is very important. Exercise, sleep, and nutrition, finding a balance in your life and in those areas can be a help, and that is doing those things in addition to seeing a therapist oftentimes is very helpful. And the therapist that you might be working with, or if you see a professional, they more than likely are going to talk to you about, are you exercising? Are you sleeping well? Are you, how is your nutrition? So all those things balance together, and it's important that you use those resources, but to take care of yourself and to know that there's help available.
Thank you so much, Dr. Miers. It's really great information. And if you'd like to learn more about mental health services at Bryan, you can go to bryanhealth.org. You're listening to Bryan Health Radio. This is Melanie Cole. Thanks so much for listening.